let's go to the health budget. Okay. COVID response. You mentioned that the 2022 budget is COVID response budget, and I laud you for that. No? And we increased the budget for the health department. No? So you mentioned also earlier that we have 61 billion for vaccines next year for booster shots. Is that correct?
That's correct, Your Honor.
Okay. Have we determined, are these single shots or double shots?
Single ba yan? Double? So, is a booster single? Single shot is what I'm told, Mr. President.
Single shot. And would we know what type of vaccines we will be purchasing?
Mix. It's still a mix portfolio, just like when we purchased vaccines this year, Your Honor.
Okay. Okay. You know, I had many questions along this line, but I do not want to belabor the chairman already on the budget. No? Okay.
Thank you. Thank you, Your Honor.
Yes.
Senator Pia is a very good, very knowledgeable about the health response,
Yes,
Mr.
so
President.
we can ask the health department later on. Okay. Now, I noticed that a big percent of the amendments for health are also, so one, you have the vaccine. No, I'm sorry, Mr. Chairman, kasi magulo yung files ko rin dito eh. So one is the vaccine. What is the budget naman for our assistance for health workers?
We added, I think the total for the SRA and the benefits is around 51 billion, Mr. President.
And is that in the program fund or in the unprogrammed fund?
It's a mix. 11 is in the program and 40 is in the unprogrammed, Your Honor.
So the bigger portion is in the unprogrammed.
That's correct, Your Honor.
Okay. So I noticed that a lot of the amendments are also in the unprogrammed, diba?
Yes, Your Honor. Similar to what we did for this year, we placed the, as you moved, and the 70 billion for vaccine procurement was also in the program, Your Honor.
Yes, I understand that. But it's the first time we're doing it that benefits to health workers are in the unprogrammed this year or next year. 40 billion.
Yes, I think it's the first time, Your Honor.
Okay. Now, okay, so are the economic bodies committed to borrow this money so we can give it to the health workers? The vaccines, I understand. I suppose that the economic managers are committed to that.
Are you committed to that?
But with regard to the benefits to be given our health workers, the 40 billion in the unprogrammed,
Benefits of health workers.
committed ba?
Etc. But you're committed naman too. Asking about the commitment. Yes, Your Honor. The DOF representatives saying they're committed to that.
Okay, so maaasahan ng ating mga health workers. Okay, so that's all the benefits that we will be giving to our health workers, our frontliners.
Yeah.
Roughly 50 billion.
Tsaka yung mga namatay.
Yeah. Okay. What about for testing? You mentioned earlier that 16 billion, 18 billion for testing.
Yes, Your Honor. In the GAB, it was 5 billion, and they added 11 billion, 11 to 12 billion. So it's around 16 to 17 billion, Your Honor.
Okay, so I laud the effort of the chairman and the subcommittee for recommending this. Nevertheless, I was listening to the interpellations earlier. Hindi pa maliwanag how that money will be spent, di ba?
Yes, Your Honor. I have a submission to the minority leader. I'll also give it to Your Honor as soon as we clear up the process. We don't want to give a convoluted summary of the processes under PhilHealth, Mr. President.
Okay. What about contact tracing?
There was nothing in the National Expenditure Program. We just put 1 billion there, Mr. President.
Okay. So will the national government do contact tracing, or do we leave that to the local governments? Do we provide assistance? What is the plan for that?
I think it will be a joint effort, Your Honor, like it was initially last year, because there were no funds, if you remember, I think, for contact tracing in the GAA, but due to your efforts and the efforts of our colleagues, we were able to put funds in the Bayanihan law for that.
Yeah.
And
So So for total COVID response, how much did we allocate in the budget?
Laki, 300 plus yun, di ba?
The COVID response lang.
Include. The figure cited by DBM was around over 300 billion for COVID and COVID-related interventions, Mr.
I'm
President.
sorry, Mr. Chairman, I was only relating to health. Yung health lang.
Just to health,
Just-
just for COVID, you mean, within the health, within the
Yeah.
health budget.
You have the vaccine, you have the benefits to health workers.
Kasama na yung unprogrammed.
About roughly 150 billion, Your Honor.
Okay, just on health.
Yes, just in health, yes, Your Honor.